The objective of this video is to provide you with our recommendation for the use of the Zeus family for long-term ventilation. Clinical staff should be instructed in the medical equipment and should be familiarized with the functionalities of Dräger anesthesia devices. Make sure that an experienced anesthesia colleague is always available. Like, for example, an anesthesiologist must always be available 24/7. In the case of any problem, always call for help at an early stage. Before you connect the patient to the system, you must verify on the readiness of the anesthesia device and the accessories. More information will be shared later on this video. A separated emergency resuscitator must always be available for you in the workplace. This is to secure patient ventilation in the case of failure of the system. For non-invasive ventilation, an ICU mechanical ventilator or a non-invasive ventilator should be preferred. Always remove from the anesthesia device the anesthetic agent dosing modules. The smallest amount of anesthetic agent might trigger malignant hyperthermia on the patient or on the clinical staff. To remove the anesthetic dosing modules, you have to press on the release button and slide it out. Please be aware, this module is heavy. Make sure nitrous oxide is not supplied to the anesthesia device. You have to disconnect the nitrous oxide hose, first from the gas supply and second from the back of the anesthesia device. Make sure also the nitrous oxide cylinder is disconnected. Keep in mind that manual ventilation mode from the ICU mechanical ventilator, it is not equal as the one in the anesthesia device. Therefore, use manual spontaneous mode only after being instructed. When using the anesthesia device for long-term ventilation, it is not recommended to use the post mode, neither the external fresh gas outlet. When using the Zeus anesthesia device for long-term ventilation, always use fresh gas control and not auto control. Be aware that while using volume control ventilation modes, the leakages on the system are not automatically compensated. Therefore, pressure control ventilation modes are always preferred. In the case of deficit of fresh gas flow, you can identify it by an empty manual breathing bag. In this case, you have to act immediately. First place, you will have to identify and correct the leakages on the system. Following, you should increase the fresh gas flow. Additionally, you can detach the manual breathing bag from the breathing system. This will allow ambient air to be drawn into the system, but be aware that the fraction of inspired oxygen might be between the set percentage of oxygen in the fresh gas flow and 21% from the ambient air. Always stay in the vicinity of the anesthesia device when using it for long-term ventilation. Keep in mind that the design of the alarm management in the anesthesia device has been done so for the operating theater, where the user is always next to the anesthesia device. Therefore, the recommendation is always to set the alarm volume to the maximum level. To do so, you have to press Screen Setup, then you go to Bright Volume tab, and then you select in the alarm tone volume the maximum level. Be aware that the alarm will not be longer displayed on the device once the situation triggering the alarm has disappeared. Therefore, if you need to verify if any alarm occurred in the absence of the user, you can go to the alarm log. You go and press the alarms button, and then you go to the alarm log. There you can scroll down to verify all the occurring alarms. You must verify on the accessories at least every 12 hours. The main accessories to verify are the soda lime canister, the gas measurement water trap, the breathing hose system, and the patient filter. You must verify on the condition of the soda lime. To do so, visually inspect the color change on the content. Make sure that no more than 2/3 of its content has turned into color purple. Additionally, you have to monitor the inspired CO2 level on the display. If the level has gone above 5 millimeters of mercury, you will have to exchange the soda lime canister. Even though high fresh gas flows are used, the soda lime canister should always be connected to the system, except when it is exchanged. To perform the exchange of the soda lime canister, first you will have to press on the release button and slide the canister out. Then you take a new canister and take the cap out. You also have to frequently check on the gas measurement water trap. You have to make sure that the condensed water on it is not above 50% of its content. If this is not the case, you will have to drain it. To do so, first you will have to disconnect the sample line and take the water trap out. To drain the water trap, you will have to use the lower color port and a standard disposable syringe. You connect the syringe to the lower color port and you drain it. You might need to repeat the process if there is still water on the trap. After you drain it, you place back the empty water trap on its port and you reconnect the sample line. In the case the second water trap has also condensed water, you will have to repeat the procedure to drain it. You must also verify on the breathing hose system and drain the water. Our recommendation is to use breathing hose system that uses water traps. To drain it, you just have to remove it and just drain it. And then you put it back on its place. You must additionally verify on the patient filter. The recommendation is always with an anesthesia device, use a mechanical filter. But when using it for long-term ventilation, the recommendation is to use a mechanical filter together with HME to improve the passive humidification. Also, keep in mind that you should place the filter on the breathing hose system the closest possible to the patient. Additionally, to the normal exchange frequency of the patient filter, you should verify that it is not too humid or soaking water. Otherwise, you need to exchange it. The hospital guidelines with regards to infection prevention should always be followed. The gas measurement sample line should always be connected to the patient filter and to the water trap. This is because the measurement of oxygen and CO2 are done through this system. You must closely monitor the CO2 and the oxygen levels of the anesthesia device. Remember that the inspired fraction of oxygen might differ from the percentage of oxygen set because of the rebreathing system of the anesthesia device. Be aware that the manual breathing bag should always be fully and evenly filled and will also move in synchronization with the mechanical ventilation. Be aware that drug nebulization and aerosol therapy are not suitable for the anesthesia device. During normal operation, You should do the self-test on the anesthesia device every 24 hours. When using it for long-term ventilation, you should perform the self-test at least every 72 hours.